Episode 41F Ishan and PM2.5 causes autism spectrum disorder and lung cancer. Episode 41F1 of 2 Ishan in Korea shows a causal link between PM2.5 and autism spectrum disorder, ASD. Ishan noted that short-term exposure to air pollution is associated with an increased risk for hospital admission for autism spectrum disorder, ASD, in children, according to a study published online September 20, 2022, in the British medical journal, BMJ Open. A researcher from the Jeju University School of Medicine Suwon, South Korea, and colleagues used data from the Korean National Health Insurance Service for 2011 to 2015 to examine the effects of short-term exposure to air pollution on hospital admission for autism spectrum disorder, ASD, among Korean children of ages 5 to 14 years. Exposures were daily concentrations of fine particulate matter, PM2.5, nitrogen dioxide, NO2, and ozone, O3, levels in each region. The researchers found that the risks for hospital admissions for autism spectrum disorder, ASD, were increased with PM2.5 levels at lag day 1, NO2 levels at lag day 5, and O3 levels at lag day 4. These results emphasize that reduction of air pollution exposure needs to be considered for successful ASD symptom management, which is important with regard to quality of life and economic costs, the authors wrote. Episode 41F2 of 2 Ishan and India states air pollution causes lung cancer and proposes some mitigations. Ishan noted that PM2.5 are tiny particles present in the air, which when inhaled can cause inflammation in the lungs, which can lead to cancer. By eating healthy food, eating fruits, doing workouts, you might be thinking that you are taking full care of your health, but are you missing something very important? What does research say? According to research by the Francis Crick Institute, in 2019, more than 3 lakh lung cancer deaths worldwide were due to air pollution. A lakh is 100,000, so the research showed that more than 300,000 lung cancer deaths worldwide were due to air pollution in 2019. This research was done on 40,000 people. In the research, scientists found that in areas where the amount of PM2.5 was high, the rate of other types of cancer was also high. PM2.5 are tiny particles present in the air, which when inhaled can cause inflammation in the lungs, which can lead to cancer. These tiny particles can prove to be poison. 6,000 people die every year in Britain. Research has found that about 6,000 people who have never smoked die every year due to lung cancer in the UK. However, it is not that smoking does not cause lung cancer. Smoking is considered to be the biggest cause of lung cancer. But air pollution is also an important cause of this disease. Pollution is a big problem in India. In such a situation, how can you protect yourself from lung cancer or any other serious disease due to air pollution? This question comes to everyone's mind. What did an All India Institute of Medical Science, AIIMS, doctor say about this? 1. Pollution is at a higher level in the morning and evening, so instead of exercising in the open, it is better to do it indoors. 2. Take steps at your level to reduce pollution. Farmers should not burn stubble. People should also try to reduce the use of vehicles. 3. Do not smoke. Do not use tobacco. 4. Avoid going to high pollution areas. 5. If you go to an area where pollution is high, then go with a mask. 6. Do not be careless. If you see any kind of symptoms, go to the doctor immediately. What are the symptoms of lung cancer? 1. Bleeding from the mouth when coughing. 2. Weight loss. 3. Chest pain. Mary noted that the focus of residents against wood smoke emission particulates, ROSEP, is on the health effects to near neighbors of living next to residential wood burning, in those hyper-localized areas where the source of particulate pollution, PM2.5, is concentrated. PM2.5, particulate matter of 2.5 micrometer size, is the perfect size to infiltrate the human lung, causing a cascade of human health problems. Wood smoke consists of 90% PM2.5. Residential PM2.5 monitors can be purchased by neighbors from Purple Air for less than $300, and their locations are put on the online Purple Air map, along with data uploaded every 10 minutes, available to the general public, and of course, to governmental authorities. Neighbors of residential wood burners would like their Purple Air PM2.5 monitor data to be used to regulate and shut down residential wood burning detected at neighbors' fence lines that exceeds the World Health Organization, WHO, standards of 5 micrograms per meter cubed or future U.S. standards of 8 micrograms per meter cubed. There could even be court-ordered monitoring using a neighbor-owned Purple Air PM2.5 monitor as a breathalyzer, similar to car breathalyzers court-ordered for repeat drunk drivers, to turn off the ignition of a neighboring indoor wood stove when levels of PM2.5 in a near neighbor's yard is exceeded. In this way, governmental authorities would not have to check the make and model of an appliance and would not have to rely on unreliable certification and other worthless assurances of levels of wood stove particulate emissions by the company that manufactured the wood stove. Purple Air monitors also provide data every 10 minutes 24 hours a day, and data can be downloaded from the map by governmental authorities the day after the PM2.5 levels are exceeded, during normal government working hours. Purple Air PM2.5 monitors are so reliable and accurate they are put on U.S. Air Now smoke and fire maps alongside $100,000 Environmental Protection Agency, EPA, monitors, correlated to the EPA monitors with a simple mathematical formula. But to publicize this, it is necessary to point out that living hyperlocalized next to a residential wood burner is essentially the same as living hyperlocalized next to any kind of PM2.5 emitting wood burning appliance, next to a PM2.5 emitting wood burning wildfire, or next to a PM2.5 emitting industrial biomass wood burning facility. Air pollution